Tonight we are going to be talking about how to recover from a BBL. And full disclosure, full warning, this is going to be long of things to go through. This is meant to be a very comprehensive video and to disseminate all the information that I can. And we're going to be doing it over 2 nights. So tonight is going to be the first night and starts at 7. And tomorrow night it's going to be the second. There's going to be time for questions. And tonight is going to be a little bit interesting because I've got a lot of props and arts and crafts and things to go through, because I really want to explain to you my philosophy, my understanding, and where we are right now as to how to treat somebody after having a BBL, and what can we do, what can you do as a patient to get the very best result. And we're going to be focusing a lot about skin, and so we're going to be going through and we're going to be talking about fascia. But there's kind of 2 separate parts to this if you look at it, in that we're going to be going through all the regular things as to, bleeding and incision care and all these types of things, medications. But we're also going to be going into a little bit deeper dive. I kind of feel now people are a little bit more educated, and so they're wanting more information and they're capable of understanding more information because of their background. So if you watched me in September, I did the same thing in September, but it was how to prepare for a BBL. And that was kind of like part 1 and 2. And if you think about it, tonight is going to be how to recover from a BBL. So this is part 3 and 4. So if you watch 1 and 2, you already have your OG tote bag. If you don't have your tote bag, then you probably didn't watch 1. Just let me give you a little bit of background on me. My name is Carl William Schwartz. I go by Dr. William. I'm a board-certified plastic surgeon. I'm originally from Canada. I grew up on the west coast of Canada in Vancouver. And then I moved to London, Ontario to do medical school, moved to Detroit, joined my wife, who's American, and did my general surgery. I also did a master's degree in genetics during that time. I then moved south to North Carolina, where I attended Duke University for my plastic surgery. And then I have my practice in Miami. I created the concept of OG Lipo. And this is not going to be all about OG Lipo, but I want you to sort of understand my background. Or basically, the whole concept of the OG is to produce natural, beautiful shapes and that are similar to what are found in nature. And we're all animals, we're all in nature, so I think it makes sense to do that. So I'm going to give you just a tiny background as it pertains to this particular discussion about how to recover from a BBL. And if you look at my pathway, my first focus when you start out as a surgeon, no matter what you're doing, your first focus is going to be on your results. And I refined my technique patient by patient. I developed the OG. And one thing, after you kind of get comfortable with that and you feel that you're competent with that, it starts opening up other things. And I started looking at recovery, and I noticed that there was really no real consensus of the correct way or a unified way that all people kind of shared as to how to recover. And so I started and I created the OG Faja, and that has done very well. It's been well received. I still love it. I use it in all my patients. I think it really gives you the best result. But once I started into that whole concept of recovery, I then created OG Recovery and as a separate entity, and began to really focus specifically on the recovery. And so that's what we're going to be talking about tonight. So I don't expect you to read this, but this is kind of my thinking as to how things go, and I'll just share that with you. So I'm a scientist by nature. I did my undergraduate degree in cell biology. I did my master's degree in genetics, and I hold a medical degree. All of those heavy science. When I was in high school, I was heavy science. So when you're in the scientific world, you really learn the typical scientific method. And what we do is we conduct a study, and from that study we gather data, and from that data we make recommendations. So these are typical things like if you're looking at a blood pressure medication, you'll take a massive group of patients, divide them up, make sure that they're similar, and then you'll give one group one drug and one group, a different drug or something, and then you collect the data, and then you can make a recommendation. So if you go to see a cardiologist and you have all these features and this and that, then your cardiologist, every single cardiologist will tell you like, okay, you should be on that drug. That's what they recommend. That's based on data. One of the problems that we've always had in plastic surgery, because it's such a subjective specialty, we can't measure, decreases in mortality and blood pressure and these types of things that typically get done in these types of studies. So we tend to be lacking data. Nobody compares wearing a faja for 4 weeks versus wearing a faja for 2 weeks versus wearing a faja for 6 weeks and then comes out with some conclusion. So we don't really have data. So when you don't have data, what tends to happen is you get a bunch of opinions, and it's kind of like the loudest one in the room is correct, or sometimes these opinions just become, taken for granted that they're true when they may not be true and they're not based on any data. And so what I find is that when you don't have the data, you'll get all these opinions, and they're really based on one person's experience. Maybe they went through it, their sister went through it, they had an aunt that went through it. And so it's a limited amount of data, and it's a limited data point. You don't really get good information from that. So I'm not saying I have the data, but what I do have is 10 years of training, a lot of reading, a lot of thinking, a lot of talking with colleagues, going over complications. And at this point now in my career, I've had the benefit of operating on thousands of patients. So while we don't have the data for what I'm going to be telling you, I think we have the next best thing is this experience. And that's what I'm going to share with you tonight. And we're going to be talking specifically, and I'm going to be unveiling this OG recovery protocol, which is eventually I will have a protocol for recovery from all the plastic surgeries, and I'll get that from experts in other fields. For example, I don't do face and ears and nose and eyes anymore, but I was trained in it, and I did do a fair amount myself early on in my career. But my goal is to develop a protocol for all of these types of surgery. So you've got some place to really go and say, okay, this seems like a good place to start. It's not going to be not every single person will agree with it. It's not meant for that. This is just what I've taken down based on my experience and what I've put in. And I haven't done it willy-nilly. What I've noticed is I see a lot of times people like, well, how long do you wear the foams? How long you wear boards? Everybody says, oh, 1 month, 1 month. Why 1 month? I don't think anyone's really thought of it. It's just a convenient term. So hopefully tonight you'll have an understanding for not just what is the OG recovery protocol, but why it's there and why I'm suggesting these things and why I recommend these things. So there's a lot to cover. We're going to just take some baby steps first, and we're going to kind of go through this 2-part class as a timeline from post-op day 0, which is your day of surgery. That's what we call post-op day 0, all the way for 12 months. And I'm not going to get into all of this, but we're going to be talking about all of these things. And then we're going to take that deeper dive that I was talking about. We're going to talk about fascia. And I brought some little props here that we're going to be using, and some diagrams as well, so that you can understand what the thought process is behind these recommendations as to how I think you can get the best recovery from having a BBL. So I'm going to go through some of the things that are a little bit more obvious, and some of them are a little bit more dry. But remember, I want this to be comprehensive, so you're just going to have to bear with me with some of these things. Not all of it is going to be as fun as playing with the fascia. So if we just start right away at the very beginning, post-op day 0, post-op day 0 starts as soon as you leave the operating room. You're already going to be in a faja. And what I recommend patients do at this point is they start to use the roller, and they can use that right on top of this faja, and it's going to just help with sensation. We'll talk about that after, but you're going to start to use the roller right away. You're going to be leaking and draining a lot of blood-tinged fluid. That's normal. You may experience lightheadedness or weakness, and obviously you're going to be uncomfortable. It's going to be some discomfort to begin with. You're going to eat a light meal and go to bed, and you're really going to just kind of drain and relax. Now, that doesn't mean that you're just going to take the rest of the night off. You're going to walk. You're going to walk frequently every hour while you're awake, and during this whole period of time, you're going to need 24-hour care. You're not going to sit during that time and except to use the bathroom. You don't need to change your faja on that first day. It's going to be messy. If you change it, the new one's going to be messy. Again, we do recommend getting 2 fajas, one to wash, one to wear. But at the first post-op day, don't be changing it. Just stay in it. It's going to be messy. Just that's the way it is. You're going to sleep on towels and blue pads. You'll take your narcotics, your antibiotics. We're going to have you sleep on your tummy, no pressure on your butt. And the frequent walking. Frequent walking is so important because it prevents blood clots. Your follow-up appointment is going to be the next day after surgery. This is pretty typical in the industry, I would say, for people to come back from a large operations like this the next day. It's not a time where we're looking at results or talking about how much fat here or there. It's simply just looking at you from an overall health point of view. Make sure your vitals are good. Make sure you look okay. Make sure that there's no excessive bleeding or any immediate problem. It's pretty uncommon to have something early, but we want to make sure everything is good. And the first day is when you get your first massage. And we're going to be talking about massages in detail, but you're going to remove your faja and get a traditional massage and replace it with a new clean faja. People tell me that the massages are They feel wonderful after having it done, but we like to start that right away on the first day after surgery. Now, I'm going to go through and we're going to talk about a few different points. And I will say, just bear with me, I want this to be comprehensive, so I'm going to be talking about these little points before we get to some of the really fascinating things. Incisions are left open purposefully. These are my incisions. I know other surgeons close them. I'm just talking about what I do in my practice. And now we're talking about post-op day 1 to post-op day 14, which is the first 2 weeks after having your BBL. And there's a lot that goes on during those first 2 weeks. So it's very busy. I'm going to go through all these types of things. The reason the incisions are left open is they're draining that fluid, the extracellular fluid, which is a combination of the tumescent fluid that I put in to perform the liposuction, as well as the lymphatic fluid that will drain out of you, that your body produces. So it's a combination of those fluids that's coming out with a little bit of blood. It's very rare to have any active bleeding during this time, but you'll definitely have some blood loss as some of the areas are still oozing a little bit. Don't put any bandages or glue or try to close these, butterflies, anything like that. They're supposed to be open. They're supposed to drain. Just cover them with dry gauze and change as needed. At the beginning, you'll have to change fairly frequently. You can use ABD pads, which are the thicker pads, but do not use those on your skin. There's a little material that's on that skin that's a non-adherent material that I've seen really cause a lot of problems with dermatitis and even cellulitis in patients. So put the gauze on and then put an ABD. The ABD will help with the absorption. An important point I think most people know at this stage is do not allow them to be reopened. We've seen that many times, and I've seen it lead to infection a lot. And if we just think about it, you know, all these things have a reason and a purpose, and it's been thought out. And I've been doing this for years, and you develop different techniques. I used to use drains at one time. I've been no drains, drains, no drain, drain. You know, I've been through every different combination, and this is where I am now in my career and what I recommend. So they're not meant to be closed, and they're not meant to be opened. You just have them while they're open, they drain, and you don't do anything. And once they close, they're closed. You're not really going to get any benefit of opening up an incision anyway, because most of that fluid, the extracellular fluid, has evacuated during those first 48 hours. It's normal for that drainage to happen after a BBL for the first 48 hours. It's the tumescent fluid and the lymphatic fluid. And what we're doing is, if we're worried about bleeding, one of the reasons you're wearing the faja is for compression to help stop the bleeding. So the treatment, sometimes if I've had a patient that's gone to the hospital for a blood transfusion, for example, which can happen, then immediately the hospital will take the faja off. And to me, it's like makes zero sense, because the faja is providing compression. If you're worried that the patient is bleeding, for God's sake, don't take the faja off. That's what's giving you the pressure. So you want to wear that for the first, want to make sure you're compliant with that first 24 hours. Now, fever, totally normal after having a general anesthetic. All my BBLs are performed under general anesthetic. When you have a general anesthetic, you get these little micro collapse of these airways. They're called alveoli, and your body generates a fever in response to that. The treatment is not Tylenol. The treatment is deep breathing and walking. And you can use an incentive spirometer if you like. I think it's a good idea. They're little tiny plastic. They're not very expensive. They're just a way for you to inhale. It measures how you're inhaling, measure your volume. It's useful to have. We use it for a lot of the big abdominal surgeries and general surgery, for example. But it's not a sign of infection to have a fever the first 48 hours after surgery, after having a BBL with the general anesthetic. It's actually normal. Now, there are people that don't generate a fever, and sometimes they're concerned that's abnormal. It's not abnormal if you don't have a high temperature, but it is normal if you do. Swelling. It's normal to swell after 72 hours, or swell after having this operation. You swell a lot, and that's going to be an important component of what we're discussing later on about the swelling. Swelling usually peaks 72 hours after surgery. So I think some people are under the understanding that swelling sort of happens right away in the operating room and then it starts to go away, but it's really not. Swelling starts to happen post-operatively, and it peaks at that 72 hours. It's normal to have swollen hands and feet, or your face as well. It's normal for patients to feel bloated. Sometimes anesthesia will do that. And your skin should feel lumpy, bumpy, and be numb. And that's all normal. Everything I'm telling you here is normal. And over these first few days, occasionally you feel lightheaded, particularly if you've taken the faja off. That's why you never want to remove your faja without someone with you. Occasionally you get nauseated, and sometimes patients will develop a headache. Sometimes it's as simple as a caffeine withdrawal headache, but sometimes the medications that you get or not eating for a period of time will contribute to that. Medications, during these first 2 weeks, you're going to continue to take the narcotics. Usually you'll take those narcotics during the first 48 hours, and most people kind of wean themselves off by then. We want you to resume your folate, vitamin C, and iron if you were taking those preoperatively, which I typically recommend. Then we're going to want you to resume those postoperatively. You've had a blood loss, you're going to need to rebuild up your hemoglobin, and you do that by relying on your folate and iron and a bunch of things, but those are two very important things that will help you. When you're weaning off your narcotics, you can substitute for Tylenol. Just be very careful when you substitute, because the prescriptions that I give, for example, Percocet, but Vicodin, Norco, they're similar in that they have the narcotic in them, but they also have the acetaminophen, which the trade name is Tylenol. So you have to be careful. You can't just you can't be in a situation where you're taking too much Tylenol. So just follow the directions on the bottle of your Tylenol, and know that your pain pill is basically equivalent to one Tylenol. So you wouldn't take 4 Tylenol at one time, therefore you wouldn't take 2 Tylenol, 2 pain pills, for example. Do not take any of the anti-inflammatories. That's an important point. Nothing like Aleve, Motrin, aspirin, any of those things, because they're going to contribute to you bleeding. With bathing, you're going to wash with soap and water in a shower as you normally do. No special soaps are required. We want you to keep your body clean, and you do it just the way you did beforehand. You take a shower, washcloth, soap, and you just wash everything. Just pat the incisions dry when you're finished, but you can start taking a shower right away on post-op day 1. But be careful, just make sure somebody's with you, because we don't want you to be lightheaded and be in the shower unsupervised. No baths though. We don't want you soaking in a bath and having fluid going in and out of those incisions. A little bit of water over top of the incisions is fine, but no soaking. I don't think you need any special soap or antibacterial soaps, just regular plain old soap to remove the dirt. No sitting for the first 2 weeks after surgery except to use the bathroom. I don't want my patients to lay on their sides or their back, because I put a lot of fat on the sides, and we could have some fat loss from there. So I recommend to my patients only to lay on their stomach. Pain, normal to have pain with this operation. There's no way around it. The only way for you not to have pain would be to keep you asleep. Obviously, that's not possible, although I wish my dentist would do that with me for like a week. But typically the pain is the worst over the first 2 or 3 days. And after that, you really turn, you're not all of a sudden back to normal, but it changes to more of a bruised soreness type feeling. And usually the initial pain is fairly well controlled with narcotics. And then after those 72 hours, when you kind of get more of that soreness, you can transition to the Tylenol just by itself. Word about traveling by car. Obviously, that's how you're getting to and from your post-op appointments and your massages. You're going to be laying down, so you're not going to be in the typical place. Make sure you're still using your seatbelts. And, I would just limit travel in this manner. That's not the way everything is designed to be used. So I would limit the amount of travel you're doing. That's only for the first 2 weeks. Excuse me, because after the first 2 weeks, you can drive, and you can drive on a BBL pillow. And if you go on YouTube, you'll see some pretty funny videos of people driving with pillows. It's quite remarkable. Here's something that's important to understand, and that is depression. And I've done a podcast on patients' mental response to plastic surgery. It's really a whole nother area that I'm not certainly an expert on. I would really like to spend more time reading and talking to some psychologists and some psychiatrists about this, because it's very common, and I do think that that everyone to some degree goes through some case of the blues when they have surgery. Usually it hits a little bit later, like around 5 days, when I think that's when everything kind of catches up to you. You can imagine you're sore, you're not going to be sleeping, you're going to be sleeping in a new way on your stomach, you're going to be wearing a faja, you're going to be having to get up to walk. As your body starts to mobilize that fluid, you're going to be peeing a lot, so there's going to be a lot of up and down. There's going to be other family that may or may not be that supportive of your decision to have surgery. So there's just a whole constellation of factors that go into it that can lead you to be depressed. And I haven't seen this become a true clinical depression, but I've certainly seen it many, many times where patients will be quite teary-eyed, or sometimes they'll be almost apologetic for feeling blue. And I'm like, listen, this is totally normal. And it usually just resolves on its own as patients recover and they can kind of get back to what they normally do. And I think a lot of us, we like to go on vacation, like, oh, I'd never go back to work. But then at the end of vacation, we like to go back to work. And as humans, we kind of like to be productive in doing things. And I think that's part of it too. When you're recovering, you're in just a totally different environment than you normally are on a day-to-day basis. So just kind of getting through the recovery and healing and getting back to your normal life really kind of resolves that depression. So let's just stop for a moment. I wanted to just kind of go through some of those things and get them out of the way. And then I want to get a little bit deeper into this, because to me, this is really fascinating. And if you look at it and you just stop for a moment and say, like, what are we trying to do? I mean, well, obviously we're trying to remove the fat and we're repositioning it to another area because we're trying to get a better shape. I mean, that's the main goal of all of this whole operation, this subtraction to try and get a better waist, to remove the bra fat, to get a flatter tummy, and then adding the fat, the addition of the fat, in order to get the nice convex part of the OG where you get projection. So that's what we're trying to do, obviously. But to me, it's like, well, whenever you do something, there's always some outcome that you measure. So even if it's not a formal study, you go to a restaurant, you're like, well, would I go back there or not? There was always some measurement. And here, what are we looking for? Well, obviously, we're looking for the shape, as we talked about. But I think the other thing that has not been a focus as much as it could be is we want the skin to look as normal as possible. So, and we want the nerves to behave like they normally do. So I think we're now at a stage, I was kind of alluding to that at the very beginning, where I think we've got the technique down, we know how to do this, but let's put a little bit more thought and a little bit more energy and effort into trying to get the skin to look as normal as it can, so that it can look like you haven't even had lipo, and try and get the nerves to behave completely normally so they're not giving you signals that you've had liposuction. So that's really the target. That's really the goal, is to get a better shape, normal skin, and normal nerves. That's the way I look at it. So if we just kind of take it piece by piece, the better shape, that's done. That happens in the operating room. And now we have to kind of focus on, okay, what do we do for the nerves and what do we do for the skin? And that's what we're going to kind of be talking about a little bit more for the next little while. So the nerves are actually pretty easy to take care of. The problem is people don't do it. And so it's something very simple, and yet it's not being done. And if you don't do it, your nerves really act up and they can give you a lot of problems. So it's simple. It's touch therapy. I've spoken about this before. It's different than massage or rolling. It's very simple, gentle, light touch. You can do it. Your caregiver can do it. Anyone can do it. I was going to say the milkman can do it, but there is no milkman anymore. And the point is, anyone can do this. So it's not complicated. It simply is touch. So just with your hand, very gentle touch. If you want to get a little bit more sophisticated, you can use varying types of touch, either with your palm, with your nails, firmer pressure, lighter pressure, little tapping, anything you can think of. You can use different objects. Using those things on your skin with multiple types of sensation will help with nerve regeneration. So that's a pretty easy one to fix. Now, what about the skin? And this is where things get interesting, because there's no just immediately apparent answer. A lot of it is still being worked out. But I think now we're at a point where there are things that we know that people are doing that are wrong, that are actually making the skin worse, when they're thinking the skin is getting better. And that's why I'm so worked up about this, because you know what it reminds me, if you'll indulge me for a moment, tell you this story. When I was a young 16, 17, 18-year-old kid, I did a lot of water skiing in British Columbia, where I grew up, and I used to compete water skiing. But before I started to compete, I just had learned from my father and my older brothers, and was a recreational water skier. And we'd spent a month at the lake. We were all pretty good at it. And you'd see us ski, and we have the big walls of water go up. And then when I took my first lesson, I remember Gary Athens, who's a pretty famous, his family's very famous in Canada for sports. And I took my first lesson, and because it was just a recreational pastime really at that point. And I remember he kind of told me, like, you're doing everything totally wrong. Your hips are back, they need to be forward. Your legs are straight, they should be bent. Your arms are out here, they've got to come, everything. He essentially completely changed everything I was doing, because he was turning me into a competitive professional style skier where I would go through the course. And the rest of the time I was just out there going behind the boat, lollygagging around. Well, once I figured out the proper technique, and then I joined a thing, I skied with other people and some really phenomenal water skiers, I realized, what in the world? Every single person you see out there on the lake are skiing wrong. I mean, how can this even be where we're all learning this and everyone is doing it and we all look the same? Some are better than others, but we're all doing it wrong. And then I started skiing on this other lake with these professional skiers, and they look totally different. And so they said the same thing to me. They're like, well, you're a good skier, but you're not going to get through the course like that. So I had to learn to do it the proper way and completely change the way I skied. And I became a significantly better skier after doing that. And what in the world does this have to do with what I'm talking about on YouTube Live tonight? You might be asking me. Well, it's because I feel the same thing is going on. Everybody is doing the same thing for the skin, and I don't think it's necessarily the correct way to do things. So let's take a dive in here and let's talk about the skin. And this is where, if you were sleeping before, now's the time to pay attention, because now we're talking about good things, and we're going to go through all of these things: the boards, rollers, massages, fahas, foams, manual lymphatic drainage, and we're going to talk about all of these things as it pertains to the skin. So let's first off start off talking about the faja, because the faja is really the cornerstone. It's the most important thing to have after you have a BBL. I got a faja here. It's essential for a variety of reasons. Number one, it's going to, well, let me stay with my slides. I'm getting ahead of myself. You're going to wear the faja for 3 months after having your BBL. Or if you just have liposuction, it's exactly the same protocol. For the first 6 weeks, you're going to wear your faja 24 hours a day. The second 6 weeks, you're going to wear it just in the day for 12 hours, and then at night, you'll sleep without it. Important to know, the faja should be snug and tight, but it should still be comfortable and not interfering with your breathing. This is an OG faja, and I mean, this is true Colombian power net, and it is extremely compressive. It's very strong, And I have in the key area, it actually has 4 levels of compression. So it's particularly strong. So this is very powerful for compression. And you always want it to be snug. If it's not snug because you're going to be shrinking in size, then either get it tailored or downsize by a smaller faja as you shrink, or you can do both. It doesn't matter. You can get it tailored and then end up needing a new one or whatever you want to do. Some pattern like that. One thing, please do not do, and because I've seen a lot of problems with this personally, is to wear a waist trainer over your faja. You don't need more compression than what your faja provides, and we're gonna be getting into this because I've got a bone to pick with compression. So let's just back up and say, what is the purpose of the faja? Well, I just said it's the cornerstone of recovery from a BBL. Well, what is it? Well, why? What's the purpose? Well, number one, and this is a very important, is this is for comfort. So this provides you with comfort. It makes you feel better. Of course, they're tight. It could be uncomfortable to wear a faja if you're not accustomed to doing that. But they do provide you with comfort post-operatively. They apply pressure to limit bleeding. So this is like you've got something bleeding and there's pressure on it. So that's a very important function of the faja. Obviously, that role is more important during the first 48 hours than it is down the road. But during the first 48 hours, it's very important to limit bleeding. It also closes dead space. And dead space is an area where the fat has been removed. And I'm just going to show you a little picture of that here to go through this. Let me just move this computer. And when you close that dead space, okay, here we are right after liposuction. And this is a little schematic drawing, but it's good. And what this is this is the muscle here, down here, this red. And then there's a layer of deep fascia. There's a more superficial fascia. We're going to talk about that. You're going to go to bed when you close your eyes tonight. You're just going to hear the word fascia. Or when I train in Canada with British instructors, they'll be calling it fascia. But anyway, so here's your muscle. You got your fat or these blobs, and then this is this fluid. So right after liposuction, there's some fluid. You've taken out the fat from all the little areas, but there's still some fat behind, and then there's spaces in between, these little spaces in between, and that's filled with fluid. And that's why we leave the incisions open in order to let that fluid go out. But one of the things that we want to happen is we want this skin, an overlying fascia, to get back down and stick to this deeper fascial layer, to the muscle kind of. And so we want this whole area to get compressed. And the faja will help with that by having that area to get depressed, to compress and close that dead space. So that's one of the reasons, because if you have one of these areas open, and I've certainly seen this many times, if people haven't worn their faja, you're more likely to get a seroma from that. So that's another reason of using the faja. Also, in areas of particular importance, like the key area, it's why in the OG faja there's more compression there, because that area, we really want that area to snug back down. And so that will help with that. And obviously, less pressure in areas where we've placed fat. Now, let me tell you what a faja does not do. So a faja does not give you a smaller waist. And I'm just going to do a purposeful pause here. A faja will not give you a smaller waist, and I know there are people out there shaking their heads or not agreeing with me, but it's true. And if you don't believe me, there's a good video that one of my video editors, Oscar, did on waist trainers, and it shows you what they do. So when you wear a faja, you want it snug, you want it tight, you want to get that compression to limit the bleeding, make it comfortable, decrease the dead space, prevent the seromas. You want that. But the faja is not giving you a small waist. That happened in the operating room to begin with. So liposuction will remove the fat. Not everyone has a small waist. There's a very wide difference from patient to patient. Some patients, it will absolutely blow your mind how tiny their waists are. And when you remove that fat, you reveal a very tiny waist. Then other patients, they're a little bit more square, and it's harder to get that waist because that's just not the way their body is. We remove all the fat, we don't get it. But you can't be that person that doesn't have naturally as small of a waist, wear a faja and become that person with the tiny waist. It's just impossible. So that's what a faja does not do. It's important to know that. It will not do things that were not done during surgery. So, and I see this in YouTube comments a lot, like, oh, well, I'm not happy with this, but I think I'm just going to wear my faja and that'll fix it. Not really. If it's not done during surgery, then your faja is not going to fix it. So it's important to know what a faja does and what a faja does not do. Let's talk about boards. So if we look at boards, you wear liposuction boards in the front and in the back. So I've got a board here. These are just a hard material. Some are really hard. This is just a piece of plastic here covered with some neoprene. And so this is firm. This board will go in your front and it goes in the small of your back. Why do we place them in those two areas? Because those are some areas where you can get some gaps with your faja. It depends on the patient's shape of their abdomen, but you can get some gapping. We don't want that. So this will help to decrease the risk of seroma. Seromas are higher in the front and in the back, particularly in the small of the back. And so we add a little bit more compression there for that reason. But compression is such a typical thing where a little bit is fantastic and too much is horrible. And so you really can overdo it with the compression, and we're going to talk about that. But you're going to be wearing your boards in the front and in the back, okay? And we're talking about getting rid of the dead space and because of the pressure. But it's really interesting to know, and this is sort of leading into what I'm going to be talking about, is that when you put this hard board on you, there's no movement there. Your body can't move with this in place, so you can't bend. You don't have the exact same respirations that you typically do. Even your side-to-side movements are somewhat limited. And overall, you feel kind of like, a little bit inhibited by it. And that's an important point. I want you to just make a mental note of that because we're going to come back to that and talk about it. And it relates to the fascia and having the fascia just kind of cemented in there. So just keep that in the back of your mind. But boards are great. I love them. I love compression. I'm a huge fan of compression. Don't get me wrong. I love compression. I just don't like too much compression or at the wrong time. So you wear these lipo boards for 2 weeks and stop. I think my computer thought I was talking to it. Okay, so compression boards for 2 weeks and stop. And I hear, and that's going to really make somebody's skin crawl. I don't want you using a compression board for more than 2 weeks, and I'm gonna tell you why. And this to me is such an important point. And I really have seen, I think what we're seeing is a lot of problems from over compression. Certainly I'm seeing it in my tummy tuck population where people are just compressing. There we're having some healing problems because of the blood supply. We don't have that issue as much from over compression with the boards in a BBL in terms of necrosis of the skin and stuff like you do with the tummy tuck. But here's my philosophy, and here's what I'm thinking at this point. So what we want, if you see here, let's just go back. I'm going to just take you through a little bit of a liposuction class here, just very briefly. So this is your situation in before you've had any surgery. Okay, you got your skin up here. You have a superficial layer of fat. You have your fascia, and then you have your fat again. The deeper layer of fat, that's usually bigger. That's a really rich source. We try not to hammer the upper level of fat too much because I can give you some contour irregularities, but this deeper layer of fat, and then again you have fascia and muscle. So that's a normal setup, and then inside your body. So that's what it looks like before lipo. Then what we do, the next step is we put the fluid in. So this shows all the fat cells now get a little bit distended. It makes it easier to perform the liposuction when you're putting the cannula in. And there's also medication in here that causes the blood vessels to constrict, so we don't get as much bleeding. So this is where we go, and we take the cannula with some types of openings on here, and we go through and we remove the fat. And then after lipo, I showed you this photo before, this picture, where now there's a lot less fat cells, but it's still a fairly big space here. That's where we're going to use the faja. That's where we're going to use the boards. They're going to do the compression. This is what we're kind of doing. You lose some of the fluid, right? Remember, we're at this stage here. You have all these fluids, so this would be maybe right away after lipo in the recovery room or something. And then that fluid is pouring out the incisions for the first 48 hours. So some of the lymphatic fluid you're making and some of the fluid itself is coming out. And then over some time, a short period of time, we're going to get some compression of this space with the boards and with the faja. That's going to compress this space. So that's what we want. We want that compression. That decreases seroma, decreases your dead space, causes skin to adhere. That's what we want. We love the compression here. Here's what I don't want. And this is to me maybe the most important part of this whole class. What we don't want is we don't want to overcompress. We don't want to compress the fascia for too long. That's the problem. That's what I think. That's what I truly believe in my heart is the problem causing fibrosis. One of them. There's a few causes, but one of the problems I think is this overcompression and compression for too long. That's why I have you stop using the boards at 2 weeks. Just stop using the boards at 2 weeks. You've accomplished what we're going to accomplish here with this compression. But when you continue to overcompress, I think what we're doing is this fascia here is I think we're just plastering this fascia down. We're not allowing any movement. It's totally static, non-moving. And I think you're getting this fascial scarring in here. And I think that's what's giving you the fibrosis. I don't think it's 100% of the picture, but I think it's a big cause. And I think it's this smashing down, over-compressing this fascia. And this is the way I told you it's going to be arts and crafts here. This is the way I look at it. So if you use my little twine here, this is the fascia. Okay, so this is fascia. You got your skin up here and your fat and everything else. So this little piece of twine is this superficial fascia here. I'm going to put it back to the normal state. Can you see that here?
Yep.
So this is the normal fascia. This is the fascia here. Now, this is what I think when you go on and you compress for too long and too hard and you get very aggressive and you think that just more compression is going to give you a flatter stomach, flatter stomach, flatter stomach. It's not, because remember that happened in the operating room, or you have to lose internal fat, the visceral fat. But the overcompression, I think it does this to the fascia. I think it just plasters it down, and the fascia contracts and it heals in this really tight, difficult to change formation. And this immobile, static, non-dynamic fascia then has repercussions because it produces that look in your skin. So you can see how you have the irregularity of the fascia, the scar contractures of the fascia, and that is duplicated on the skin. And that, I think, is a cause of fibrosis. And I can tell you, when you go back into liposuction somebody who has some fibrosis, which that's a different story, what you'll see is that these little areas, can you see this little area here?
Yeah.
So this little area, for example, that fascia can contract and become hard, and the little fat cells that are in there get trapped. And so you can have somebody come in and say, hey, I had lipo, I've got some residual fat here, I want to have lipo again. And you're like, you got some fibrosis here. And years ago, I'd be like, oh yeah, sure, I see the fat there, I'll go in and I'll take it out, no problem. And then I couldn't. And I was like, what in the world? Why can't I take this fat out? And it's because of this situation here, where you get this fascia that's scarred, that's really compressed and hard and hasn't moved in a month. And what it does is it traps the fat inside of that scar tissue. And you go to put your cannula in, and you're like, oh, I'll just go take that fat out, easy greasy. And you go in and you do it, and you just keep hitting this. And it's the most perplexing thing, because preoperatively, you can feel the skin. You're like, oh, there it is. And then you go into the operating room, you put your cannula in, and it's just like you run into a brick wall. And that's this really crappy, contracted fascia. So I don't want my fascia to be like this. I want patients after surgery to have this nice, soft, supple, normal fascia. And I think you get this with over compression, for one. There's other things too, but I think that's one of the main things that we have to stop, is I think we're over compressing ourselves. Not only do you get this fascial scarring, I do believe as well that you get scarring up higher in the dermis. So up in this area as well, in the deep dermis, and you get some deep dermal scarring as well. It gets a little bit complicated at this point, but there is some literature out there and some thought that this overcompression can set up a inflammatory state. So when you're retaining fluid, when you're getting this scar contracture, when that scar contracture is forming, it's sucking in and retaining fluid. And you can kind of set up an inflammation cycle, inflammatory cycle that contributes to the scarring of the fascia. All right, bear with me. Okay, so I see this as a big problem. I see this whole concept of this heavy steamroller that's just compression. It's necessary. I think it's great. I love it. But overcompression can lead to a lot of problems and make your skin worse. I firmly believe that. Here's a picture of a patient of mine. She has a really nice shape, and she's fairly early on here, but her skin is obviously pretty lumpy. I know for a fact that this patient, right now we're at about, I think in this photo is about 5 weeks, 6 weeks maybe, but I know from a fact that this patient was religiously compressing, 24/7, basically around the clock, over a month. And I strongly believe that this overcompression is what really caused her problem, because she did everything else correctly. Faja, massages, everything, but she was just overcompressing. And this is what we're trying to avoid. We don't want this skin. I don't want to do a beautiful surgery, get a beautiful result. Patient's got a great body, they've exercised, they've ate clean, they've taken their supplements, their iron, their folate, they've bought their faja, they've done everything that they can do. And they look great. And you see them in a dress and they look fantastic. They put a bikini on and it's like, oof. So we're trying to avoid that. That if you were to boil down the mission of OG Recovery, it's like that. That's the number one thing. So we want to avoid that. So That's my little reminder that I'm going to be drawing. That looks exactly like me. Okay, so we've talked about the faja, we've talked about the boards. Let's now talk about massages. So massages are excellent, mandatory, necessary, beneficial, and what I recommend is 10 traditional, and again, this is, everyone's going to have a different thing, and if you're a massage therapist, please don't come after me. But this is what I recommend. This is from my experience, and I stand by this. I think you should get 10 traditional massages, one every day for the first week, and one every other day for the next week. So that takes you out 2 weeks, 10 massages over 2 weeks, traditional massages. Then I think it's very important to get 5 manual lymphatic drainage massages. These are completely different massages done by maybe the same person, maybe a different person, but they have to be a licensed manual lymphatic masseuse or therapist. There's some different terminology there, but they have to know what they're doing in terms of handling your lymphatic system. And I think this is so important because when we're in this state here, okay, this 2-week mark, everything is happening in 2 weeks. We're stopping this stuff at 2 weeks. When we're in this part of 2 weeks, there's no more fluid to come out. So that's why you can't open the incision. There's no more fluid to come out. The fluid is there, but it's called interstitial. So if these are cells here, the fluid is in between. It's in the interstitial space, or it's in the cells themselves. And so this interstitial fluid is what gets picked up by your lymphatic system. So this fluid makes its way into the lymphatic system. But keep in mind, you're in this inflammatory state here, and your lymphatic system is not working at 100%. You need some help to be able to get that fluid out. The lymphatic fluid contains a lot of metabolic waste products, and they're also things that can stimulate inflammation. So we want all of that stuff out of your body, and the best way to do that is with lymphatic drainage. So I'm not a lymphatic masseuse, but I have a keen interest, and I have had for quite some time, and actually I have a podcast that I know I've been talking about it, but I filmed it, and it just needs to be edited and produced, and it's going to come out in January. And I have a great lymphatic therapist who talks a lot about this stuff, so that's going to be coming. But it's a totally different type of massage. It's absolutely necessary. It's a very light massage. This is not the traditional massage. It's a very light massage. It's non-painful. They're just opening up the lymphatic channels that are there naturally. They're up here in the skin, and there's communications from deeper to them. And they're taking that lymphatic fluid and they're helping the body open the channels so the fluid can escape. How does the fluid escape? It goes to your lymph nodes. And so if we just have a general sort of look at, if we're looking at the body and where are these lymph nodes? The lymph nodes tend to be in the groin. So they're in this area here, and they're also so they're in your groins. They're also in your armpit. I mean, there's a lot of other places, but specifically, as I wish you could see what I'm seeing. I have a mannequin over here. Every time I look up, I'm like, someone's in the room. Why are you staring at me? So there's lymphatic vessels everywhere. But the general concept is you have these lymphatic basins here in your groins, in your armpits. You kind of divide the body in half, and divide it, bisect it again, and all of this skin here drains the lymphatic fluid down to this groin. This fluid goes here. The fluid up higher goes up to the armpits, and the fluid in the back, it's exactly the same. And so the lymphatic massage treatment is going to be moving, opening up those channels to allow the fluid to go. And where does that fluid go? That fluid goes back to your heart. And from your heart, it goes to your kidneys. Your kidneys excrete all of the waste products and you pee it out. So if you imagine this fluid, fluid here, where we've got all this inflammation and everything stuck down and all that hardness, we want to get that fluid out of there. Our goal is to get this soft and supple. And one of the ways is with the manual lymphatic drainage massages. So I recommend 5 and do that over 2 weeks. Manual lymphatic drainage, you don't have to have them done every day. And the other important thing is that most therapists are really good people, and they will teach you. And so they'll teach you how to do your own manual lymphatic drainage as well. So to recap, I recommend 15 massages over the 1 month period. That's 10 traditional massages during the first 2 weeks and 5 manual lymphatic drainage massages over the next 2 weeks. That's what I recommend. The foams. Okay, what are foams? I've got some foams here. These are foams these are called lipofoams. And so these are worn very soon after surgery. They go where the boards don't go. So they can go in the upper abdomen, they can go on the sides and the flanks. And what is the point of these? Well, it says right here. You use the foams. I recommend 2 weeks for the foams as well. And you wear them where the boards are not. And the purpose of the foams, number one, they also provide some comfort to you. Obviously, this is a nice material that's soft, and you put this directly in contact with your skin under your faja. This also can prevent some of the issues that any faja can have, because it's virtually impossible to get one single faja to fit everyone. So there's always some little wrinkling and things like that in when people are wearing fajas. And this will help prevent that from going onto your skin and getting little areas that are pinched up, particularly in people that have greater skin laxity. They're going to want to make sure to wear your foams to prevent any of those little areas kind of becoming fixed. And you also get less bruising with the foams as well. I recommend stopping these at 2 weeks. Foams are great. Love them. Fantastic. Would not recommend anyone to have surgery without it, but I wouldn't use it longer than 2 weeks. Okay. Next thing. We're focused on skin. Talking about faja, foams, boards, and compression. Now we're going to talk about rolling. So rolling is a wildly underused modality for treating skin after liposuction. Absolutely a great way to get really good skin, but you have to use it properly. So just like we're stopping the foams at 2 weeks, just like we're stopping the boards at 2 weeks, we're using the roller for a longer period of time, but we're using it different over these things. So over the time. So there's a 3-step protocol with this is my roller, it's the OG roller. The reason I think we can use this in step 3 is because it vibrates, and I'll show you that in a moment. But so it's 3 steps. The first step is on day 1, right away, right after surgery. As soon as you're alert enough, you can use this on top of your faja, and this is getting the nerve regeneration. So this is desensitizing the skin and contacting the nerves so that we don't have the problems with the abnormal feelings afterwards. You're going to continue to use it just gently, just as a touch, as a form of touch, all over your trunk, every area that you had lipo. Your caregiver can use it on you as well. If your caregiver's just running all over the place, they can also use this on their calves. This works really well on calves as well as just a muscle massager. But I think we're actually treating fascia when we're doing that too. That's separate. So use this step 1, just light touch. Step 2, you're going to then, when you feel more comfortable and your skin is better, then you could use this just like a traditional massage, just like you're rolling out pizza. And this is firm. You could do this firm as much as you can tolerate. I think this is doing things to help as the compression, as the foams, as the faja. So giving another way, but it's dynamic. So remember, we don't want that fascia to just be cemented in there. We want there to be more movement in that fascia. And this is helping to bring some of that movement. So do this, but 2 weeks, you're going to stop. Then that's when we're going to switch over and use the roller in a totally different way. So just like you did your traditional massages and you stopped. You did the compression and you stopped. We're going to use the roller. You could use the roller right from day one because you're using it first for the nerves, then you're going to use it for the first 2 weeks in a traditional manner, but then you're going to use it in the third step, which is a completely different way to use it, and this is really unique for this roller. You're going to put it on high vibration. There's 3 vibrational settings. You can use the heat. The heat really just kind of warms it up so it's not cold to the touch. The heat is not doing anything particular therapeutic. You put it on high vibration. I gotta turn it on first. You put it on high vibration. You can hear it vibrate. So it's pretty strong. If that's too uncomfortable, you can put it down. There's a 2 and a 1 level. Anyway, high vibration. Gentle pressure. Here, you are using this as a manual lymphatic drainage tool. I don't think it's a replacement. I don't know why I'm yelling. I don't think it's a replacement for manual lymphatic drainage, but it's a different way of getting your manual lymphatic drainage. So you're going to use this exactly as I just explained here with this diagram, where you're going to be directing, you're not really pushing the fluid, but you're opening the channels that are carrying the fluid. So you're going to be doing that from above here on one side down to one groin, just the weight of the roller. You're not using any other pressure, and you're putting it on high vibration. And that superficially opens up all of those lymphatic channels and gets rid of the fluid. Remember, what we're trying to do is we're trying to prevent this fascia from getting stuck. So that's what I think is giving you the problem with the fibrosis and the uneven skin. We want good skin. So instead of just going in, and I mean, I just see so many videos with the wood therapy and people are doing the massages, and it's like the bigger masseuse, the better, you know, and you could really see it just looks painful. I think we're going about the wrong way. I really believe in my mind it's like the water skiing. I was doing it, I thought I was doing a great job, everything was good, and then comes to find out I was instructed by professionals, I was doing it all wrong. I really think we're at that point. And that's why this is going to be a difficult message to get out when you're that one person like, hey, I think you guys are pushing too hard. I think you're compressing too long. So that's why the roller is great for the first 2 weeks because we're setting, it's dynamic, so we're moving the fascia. But after that point, this becomes a manual lymphatic drainage tool. That's what it becomes. It seems like you're not doing anything. You got it on vibration and you're just running it like, oof, what's that going to do? It does a lot. It's getting rid of that fluid that's carrying all the toxins, and I think you're getting less inflammation in that area, and we want to keep that fascia soft. So roll, roll, roll. You can't over-roll. How long to roll? Roll for a few months. If you find that your skin is still not as smooth as you want, continue to roll. You're not going to do any harm in rolling. Okay. MLD, I've talked about it. Let me just say a couple more words about it. Make sure that your therapist is MLD certified, and that's really important. And so there's a lot of different massage therapists out there, but there's not very many who are really trained and certified in manual lymphatic drainage. So make sure you find somebody there. And what that will do is that helps with the swelling, because remember, this fluid can't come out any way other than your lymphatic, your body doing it, and taking care of the fluid themselves. It's getting rid of those substances, and I think it's creating a much better environment for that fascia and the deep dermis, which are the ones that can get scarred. The fat doesn't really scar. It's the fascia that scars that gives you the fibrosis, and it's the deep dermis in the skin that's doing that. And so by getting rid of that fluid, we're going to be softening that tissue. If you can't tell by now, I'm all about moving this tissue and softening it so that in the end of the day, we're not left with that photo with the lumpy skin, but we have really soft, smooth, supple skin where people just don't realize you had lipo and just think that you have a great shape. That's the ultimate goal. Okay, we talked about boards, roller, massages, foams, all these things are aimed at the skin. Now, I don't know if anyone's watching, but if you're watching, this is this is actually a good moment because I'm going to be talking about something here that I've never talked about before, and this is something new, and there's nothing on the market like it, and this is aimed at helping you prevent fibrosis, and it's kind of, in my opinion, the final piece of the puzzle since we've got all of these boards and everything else, and that's FibroGuard. So what is FibroGuard? FibroGuard is new. It's brand new. It's not even available yet. This is the final prototype. So it looks like a waist trainer, but it's not. You know I'm not a big fan of waist trainers. But it has inside, it's like a faja material, and it has the same kind of hook and eye that the faja does. And so, but where the magic is and why I think this is really good is because of this. Look at this inside. So these are little foam, firm foam. They're not too hard. They're not going to hurt. It's actually very comfortable. It fits. I'm not going to give you a demo because that would just turn into a meme. But it's going to fit around you like a waist trainer. You're going to put it on underneath the faja. It's soft, it's comfortable, it's adjustable. And then these foams that are here are going to be acting like little manual lymphatic drainage as they do these little micro movements. And this is going to give you soft skin with all of the other modalities. And so this is going to be, I don't even know when it's going to be available, to be honest with you. I think we're going to be taking some pre-orders probably in the new year. It's the same manufacturer that made my faja in Colombia, Shaper Lynn. They're unbelievable. They've been so good to work with in developing this project. I've had this idea for quite a long time, and it was a difficult task to be able to get the manufacturing correct, to get everything to fit properly and have all these little, just these little wonderful little bumps that are in here that are going to be constantly massaging your skin, moving your fascia so that we get this nice, soft, supple fascia. So it's not all scarred down and leaving that mark on your skin. So that's FibroGuard. That is coming out next year in 2024. I know there's going to be pre-orders. I don't deal with all that exact stuff to do, but I do with the products. But this is going to be a total game changer. I love it. I'm so enthusiastic about FibroGuard. Okay, so we talked about that. Now, that was a big showstopper. But I have a lot of things still to cover, and not all of them are quite as interesting. We got to go through some of the main things mundane things to be comprehensive. But I do think that maybe at this point, it's good to take a small break, and I'm going to answer some questions that you may have. I would prefer if you were asking about the things that I was talking about tonight, and we can keep the discussion focused on that. Rather than hemoglobin, BMI, and those types of things that are not as pertinent to what we're talking about here. So I think I'm going to slip. Can I slip over there? And we're gonna take a few questions, and then I'm going to come back and we're going to go through a few more things, when to call a doctor, and a bunch of other things like that, that are kind of typical recovery things. And then I do have some other things I do want to talk about that are not quite as mundane. But let's take some questions first, and let me go over to the question area. As we just change cameras, just a little bit easier to read some of the questions from the board. Okay, let me know one. And we're also taking questions from TikTok as well. So, correct?
Yes.
So we're also taking questions from TikTok. If you want to watch us live, which I think it's just a computer screen right now, but if you want to watch it live, then click over to my YouTube channel. But if you do have questions on TikTok, then we'll be taking those questions as well. Okay, great. Where am I reading here, Juan? Okay. Okay, how long and when do you start using? I was so excited about the fiber guard that I forgot to tell you how to use it. So, I mean, I'm so excited because I think it's if you could feel it, it just feels so nice. So what I want to do, the general philosophy is I think there's too much compression, everything's static, everyone's pushing, everyone's squeezing, everyone's compressing, it's compressing, and it's just wearing fajas tighter and stage whatever and waist trainers and everything is just so much like that I think we need to just pause, take a deep breath. At 2 weeks, stop the foam, stop the boards, stop using the roller in that aggressive way. And that's when you start the fiber guard. So we don't want the fiber guard at the beginning because we want all the compression. We want all that stuff. But then at the 2 weeks we stop. That's when we put you put the fiber guard on. You wear it underneath the faja. As to how long to wear it, I recommend you wear it. And and something I should have said, I'm going to be showing you the OG protocol. The OG recovery protocol. Do you have that? I'm going to be giving you this at the end of our. Thanks, Gabby. I'm going to be giving you this at the end of the talk, which is going to be the protocol, and I'm still have to go through the protocol. What I've been doing is kind of explaining everything. So you're going to start the fiber guard because that's dynamic. The compression and everything else is static. And so you're going to be starting the fiber guard at that point, at the 2 week mark, where we want things to be dynamic. Because that fiber guard is working. Every time you breathe, every time you move, those little foams are producing little micro movements of lymphatic drainage and being dynamic to the fascia to gently kind of massage the fascia. So that I want you to start the fiber guard when you stop the foams and the boards at the 2 weeks and continue it for as long as you wear the faja. You're going to wear the faja for 3 months total. So you're going to be wearing the fiber guard for 2.5 months. You're just not going to wear the fiber guard at the very beginning during those first 2 weeks. What types of vitamins or cleanse to do before surgery? This is going to create more issues, but I really don't recommend being on any vitamins or doing any cleanse. And you can go and look at the data on vitamins, and it's not, they sound great, but I only recommend being on folate, vitamin C, and iron before surgery. Can you get a BBL and a breast augmentation? Yes, of course. That's called a mini mummy makeover. It's a great operation. It's a really good combination. Sorry if I'm looking away a little bit. I'm reading the questions here. Hey, ideas about the fluffing stage. So, you know, I'm always amazed. Some of these questions are, to me, just so good, because I've been having this internal thought for quite a while, thinking about, you know, we know that the fluffing is something. There's something there to it. Not everyone gets the fluff fairy. And it's like, why? Why do some people get it and some people don't get it? The way I look, because I'm, you know, trying to put this into a logical concept as to how we're recovering. And I think the fluff fairy, and this sounds like the fluff fairy has a personality. I actually know the fluff fairy quite well. The fluff fairy, I don't think, if that fascia is too stuck, I think it limits expansion, and I think that's part of the problem as well. Could be some scarring there. So I haven't quite completely worked it out, but that's some of my idea. Hyperbaric bed, do you recommend? Hyperbaric oxygen? Hyperbaric oxygen is not going to hurt you, but it has not been shown with any study. But the only thing that I know of that hyperbaric oxygen has been proven to benefit is osteonecrosis, which is when you have radiation necrosis of bone. But it's certainly not going to hurt you. Some people don't. Yeah, some doctors don't recommend wearing a faja. Somebody made a comment on my YouTube today that in Europe they don't start the massage till 4 weeks after. There's going to be multiple opinions, right? Because there's no data. So the only reason I'm presenting my protocol, which I've been working on and thinking about for a long period of time, is because this is just what I've been able to figure out in my own mind, what makes sense to me and what I've seen work and what I've seen has not worked. But there's going to be a lot of different doctors with different opinions, their own protocols, their own recovery, everything else. This is just where I'm saying. Let's see. How soon after BBL can I do normal activities like walking my dog? I love dogs. As soon as you want. So there's really no restrictions after having a BBL on your activity. And what we're going to be talking about tomorrow, believe it or not, there's a lot more information to go through. We're going to be talking about exercises, diet, protein requirements, fats to eat, all this type of stuff. We just don't have enough time to do it in one night. And so I'm going to be talking about that tomorrow. But in general, your activity, you can do what you want as soon as you feel comfortable doing that. So if you're 3 days after surgery and you feel comfortable and it's safe, you're not lightheaded, you're feeling good, and you want to take your dog for a walk, then that's totally fine. The only real strict requirement we have is the no sitting. But you can walk, jump, run, do sex, exercise, whatever you feel like, as soon as you feel like it. It's just that you're not going to feel like that for the first day. Are lymphatic massages painful? No, Jocelyn, they are not painful. They are actually kind of soothing. People describe it. I know personally, my wife has had them for recovery from a facelift and neck lift, and she loved them, and it was extremely beneficial. And the only way I can say that is I know 100% she's not watching, so I can talk about it. But I'm serious though. It was when she had her first lymphatic massage. After that, it was phenomenal. It was a completely change, and she felt great. And she actually still gets them because they make her feel good. Folate, vitamin C, iron, good for surgery. Yes. So. Do you recommend radio frequency skin? I don't. And I know a lot of people do this radio frequencies, cavitation, a lot of these other techniques. I don't prefer that because I want the fascia and the dermis to be mobile. I want them to be cleared of the fluid that's in there with the toxins. I want them to be soft, and I don't want the radio frequency or anything else that provides energy or heat that can increase inflammation. We're trying to decrease inflammation and soften things, and so I personally don't like it. That's just my opinion. So if you're a big fan of it, then that's totally fine. How soon can you fly after tummy and BBL? I really don't want to get into this stuff because it's not on topic, but usually I recommend patients staying a week. Everybody who I personally operate on does get a anticoagulant post-op. Is someone with syncope and collapse still a good candidate? I would say no. To Sam, I am. Sure. So Tara wants to know about the different types of fats. There's a visceral fat, which is we call internal fat, and then there's an external fat. The external fat is removable with liposuction. The internal fat is not. The internal fat is either in your organs or around your organs, so removing that fat would be fatal. I love saunas. When are you? Is that you, Paula? No. Who's working that little hand?
That's one.
Okay, maybe Paula can work it. I love saunas. When can I do a sauna again? That's a interesting question. I don't think I've ever had that question. But saunas are much more popular. I went to Norway last year for Christmas, and oh my God, I mean, they go hot, cold. It's amazing. But saunas are really good. I would say I would wait a few weeks after having any type of surgery. I would kind of liken it to getting in a body of water. So you want everything to be closed and well healed before you're exposing yourself to anything like that. Okay, maybe we need one again.
No.
It's just they're going so fast I can't see them.
Yeah.
Can I ride in my car? I mean, I don't really like to give out advice how people should travel in their car, but I just say do it as safely as you possibly can. Do I do in-person consultations? Yes. Can I explain the
He's going too fast.
mini mommy makeover? I don't know who asked that. She's disappeared. Yes, the sorry, I forgot the question now. The mini mummy makeover is a BBL done with a breast augmentation when those are done together. What can kill fat after a BBL is, if you could just leave it there for a second, just because I can't see the question now. I forgot the question.
What can kill fat after BBL?
What can kill fat after BBL? Well, sitting on it, so pressure directly on the fat. Some of the fat we know will die. That's not all the fat survives that goes in, because the fat has to get a good oxygen supply, and not all the fat is able to do that. And we see it the same thing with dermal grafts or bone grafts or with skin grafts as well. Remember, we use a lot of different things, particularly in reconstruction and reconstructive plastic surgery. We may take part of the rib and use it to reconstruct the nose and things like that. And so never is there a case where 100% of what we transfer or put in, so the fat for this case, survives. Even if you do a skin graft, you can do a skin graft. If you look carefully, there'll be some loss of the skin along the edges, so maybe only 90% of that skin graft will take, even though we'll look at it and be like, yeah, that's good. I mean, most of that, the 90% of it took. But you're always going to have some loss. It doesn't have to be just with pressure, but it's also distensibility of the tissues. So for patients that have what I call low soil, so really indistensible tissue, it really won't move, that can also put some pressure and cause problems with fat survival there. Tamar asked about health issues. Tamar, and if you want to just DM me or leave that in the comments, I'll talk about it, but I don't want to get into that now. We just have so much information to still go through, and it's starting to, we have about half an hour left to be able to do that. When can you smoke after surgery? We recommend not smoking because, and that's coming up at the later part of the talk, just because of the vasoconstriction and the loss of blood supply. And I don't have any data to prove it, but we have data from other areas to show the impacts of smoking on healing. And I would not recommend smoking nicotine after having a BBL, because I think that will decrease the amount of fat that will survive. And we do know that smoking does increase the risks of all other types of complications from having a BBL, so including blood clots. So I would not smoke before or after BBL. I would say at least 6 weeks. Is it okay to be on antibiotics a month prior to a BBL? That's probably fine as long as the infection is completely clear and you're not currently on them.
Let's answer some of TikTok.
Okay.
Do you use ultrasound when you inject fat into
Yes. So when I do a BBL, I use ultrasound. Everyone in Florida does. It's they should at least anyway. It's mandated, and it does really two things. Number one, obviously, it's very safe. It allows you to do the BBL in a safe way because I can see exactly where the fat is going, and there's a very clean line of deep gluteal fascia. That's the fascia that's over the muscle. And I can see to make sure that I'm not below that level of fascia. If you go below that level of fascia, you're getting into the gluteal muscle, and that's where the big veins live, the big gluteal veins. And you can run the risk of injecting fat into that gluteal vein that can then go up to your heart and go to your lungs and give you a fat emboli. So we don't inject below the muscle, and we can confirm that we're not injecting below the muscle with the ultrasound, so it makes it safe. And then the next thing that the ultrasound does, that really I use it for, because you can really see pretty quickly what plane you're in to make sure you're safe. But it's really allowed me, I think, to get a better result. I can definitely get a better result with a chicken butt. Well, that's that area where you have that tightness, because in that situation, the skin is very close to the muscle. So I was always used to, before I used ultrasound, was very worried about injecting in that area. But now with the ultrasound, I can see clearly. So I can make sure that I get into the exact plane, and I can put the maximum amount of fat. Because the one thing that the ultrasound does is you can see where you've put fat, and you can see where there's still areas available to put fat. So with the chicken butt, which is very challenging to try to get that tight area to distend, I can use the ultrasound to see in there. So yes, I use ultrasound for everyone. Safety and a better result.
If my BBL shrinks, can it grow back?
Yeah, I mean, usually, so that's just the general concept that there are fat cells, and if you look at it, we're basically born with a predetermined number of fat cells depending on our genetics. Now, what we do with those fat cells is our own business. So if you eat too many calories than you burn, then you're going to store fat, and those, you don't grow new fat cells, you just take the fat cells that you have and they become bigger and they store fat. So when you lose fat, when you lose weight, those fat cells don't disappear, they stay there. But what happens is they will then shrink. So if you've had a BBL and your butt was full before and you've lost weight and your butt has gone down, you simply gain weight and your butt will get bigger because those fat cells have not been removed. They didn't disappear when you lost weight. They just got smaller. That's really the benefit and the beauty of liposuction, is that with liposuction, we're permanently removing those fat cells, so they are no longer capable of getting bigger because they simply don't exist.
Can I get a BBL and a breast lift at the same time?
Is there anything else more topical in terms of recovery? You can get a breast lift. I mean, you can't get a breast lift or a breast lift with implant and a BBL at the same time, because we want you to be laying on your tummy after the BBL, and with a breast lift, the blood supply to the nipple gets changed, and so we don't want pressure on that. You can have a breast augmentation with a BBL, because after breast augmentation, you can lay on your tummy, and that's because the blood supply really hasn't been changed to your breast very much with a simple breast augmentation.
Can you explain why regular massages first instead of lymphatic massages?
Yeah, sure. I think the traditional, so I really think you have to kind of do the heavy lifting at the beginning, and that's, I think, performed best by the traditional massage. It's really going through and helping to manipulate those tissues and helping them stick down and helping to remove some of the fluid that's there. And after 2 weeks, after that 2-week period where you get those 10 massages, I think everything has happened, everything has gone down. That's really the goal for those first 2 weeks of recovery, is to get everything to come down. I think what we're doing is we're thinking, it's great, during those first 2 weeks we're getting everything to compress and come down, let's keep doing it. But that's where you change to the lymphatic, because now everything's kind of been compressed, but there's still fluid there that's in your lymph, and that's what we want to get rid of with the manual lymphatic drainage. Somebody said, can you have liposuction and a BBL at the same time of surgery? Yes, every single BBL is done with lipo. That's how we get the fat. So a BBL necessarily includes liposuction. That's part of the operation of a BBL. Do you recommend working out your glutes up until surgery? Yes. Working out is really a benefit before and after surgery, and we do actually have, and I'll be talking that in the second half tomorrow, or maybe we'll get to it today, I'm not quite sure. There's a whole exercise protocol. It's a plan. It was developed by John Sinclair, who's an exercise expert, and he's been on the podcast, and he worked carefully to design a very detailed exercise program for patients having a BBL, and they can do all the exercise before and they can do all the exercise after. There's 7 different exercises. There's a really good video on it, and he's on my YouTube, and he's broken it down into 7 different exercises with 3 different levels. So by all means, the more you exercise before surgery, the more you exercise after surgery, the better. CC is saying, can you fix an ant look where, I know what you mean, where your butt is just big and then you have these little tiny legs coming out? It's harder to fix. I will be totally honest. I'll tell you when I can fix it, and I'll tell you where I cannot fix it. So I can fix it when there is what I call maldistribution of the fat. And that is when there's too much fat up high in the butt, I can go and I can get that fat because that's right through the key area. And so I would say quite a few people don't have lipo in the key area. And I think some of the earlier BBLs, I mean, I still see it, but some of the earlier BBLs have that really high look. There's a lot of fat up high and outside, and that accentuates that disproportionate between the butt and the smaller leg, giving what people call the ant look. So if you have fat up high, fat maldistribution, then I can lipo that out through the key area. That's very helpful. I can also graft fat from the hip into the leg and into the back of the leg and the side of the leg and a little bit in the front in order to give a little bit more volume to the leg. So I have been successful in getting patients a little bit more proportionate and not have as much of that ant look. But for there are patients that don't have the opportunity with the fat put in those areas for me to help, where their butt is just huge and there was just too much fat put in the butt, and the relationship with the legs was never really considered. See, what you see a lot is even if you just look at a video and in the operating room, and if you just look to see where the patient is draped. So sometimes you'll see this very tight draping and all that is visible is the butt. So they can't even see the leg. So when I drape, meaning where we put our sterile field and put our towels and everything, I do it down to the knees. So because I want to see that leg as I'm injecting the fat to make sure that it's going together. The way I think of a BBL is very different now than it was 10 years ago or more, because I really consider BBL now to be not just about the butt. It really should have a different name, honestly. It's really about changing the whole shape. So I'm starting high in the back, going with the lipo, going all the way down into the key area. So that's a huge area. And then the concave part is starting at the hip and going all the way into the legs. So trying to make that entire OG, the OG is not just like a little short line around the hip, it's the whole thing. And so in order to do that, you have to have that whole part of the body exposed so you can see it. And it's one of the reasons why patients waking up and being cold is a problem. We use hot fluids and a warming that's on the table, it's warm, things like that. But you're going to get cold just because we're exposing a large part of your body. But that's why I do it, because I want to see those areas. Let me take two more questions, and then Bluetronic is asking, what is your favorite post-op release to date? What is the most practical post-op device you recommend? Roller, FiberGuard? That's interesting. I mean, the Faha is near and dear to my heart because that was sort of my first foray into this, and that started a long time ago, and that took a long time to develop, and that was really, I'd never had created a product at that point, so that was fun. Right now I'm super fired up about the FiberGuard because there's just nothing out there like it, and to me it just makes logical sense, and so I'm excited about that. But I have Scar Gel, which comes in a unique bottle. I really like that. I mean, I was going to say it's like your children, you love them all, but I guess it's not really. I do have a favorite. I'd say probably my favorite, to be honest with you, is FiberGuard. I'm so excited about it. And I'm really wanting people's feedback. The people who have used the prototype really like it. It's very comfortable, and it works well. So that's probably right now my favorite. Okay, what did we say? One more question and then we'll get back to it.
Let's see that now.
Okay, I think I asked that. Somebody asked, I could say, how long after BBL do you recommend before getting another procedure? It just depends. So if you're operating in an area that has the same blood supply, so if you're talking about lipo or you're talking about a tummy tuck, those two operations have to be spaced out by 6 months at least because of the blood supply. But if you're talking about two different areas, like lipo, a BBL for example, and you want a breast lift, then you don't have to wait those 6 months because the breast lift is nothing to do with the blood supply from the BBL. You just have to be in a situation where you're comfortably recovered, meaning you're back doing everything that you normally do, and that usually takes a couple of months to be back there. But if you had a very fast recovery and you wanted to do your breast lift or breast reduction or something after your BBL, you could do that in 2 months. Okay, let me go back and I'm going to finish up with some of the other things. I want to show you the OG protocol and show you what that is. It's going to be able to be downloaded, right? There'll be a link or a description or some way to download it in the YouTube channel, and that's going to have the OG protocol, recovery protocol in it. But let me show you that before we go. I think we'll use that as the kind of final wrap up, and that'll make everything kind of make sense, because to this point I've kind of explained the why we do this and how to do it, but I'm going to just show you in a pictorial way as to how that all relates together. So let's go back over here. This is a good time to just take a minute to acknowledge my team, because I have a pretty big team. We do a lot of content, and I love making content. I like to teach, and I like to get the information out. But it's difficult when you just, I don't know how to use all this stuff, and it's so complicated. So I have a fantastic team. Is there any way for somebody to come over here, just one at a time, maybe real quick? Let's do it.
No problem.
Let me start off with Paola.
Oh my god.
Oh, she didn't dress. She's not happy. A quick hello, kiss. This is Paola. She runs everything. She's all of our mothers. We love her. This is our most difficult child. This is Juan. Juan is my videographer. You've seen him if you've seen me on TikToks before. Juan's fun. I always call him my fourth son. Such a wonderful person. Gives me no end of headaches. This is Oscar. This is the man. He went to film school, trained at Pratt. He's an incredible. When you see these crazy graphics, he's the one responsible for that. Gabby's our newest addition, but she's been here quite a long time. She's fantastic. She essentially assists with everything, and she's also very good at keeping me calm, which I really appreciate. And Mendingo, this is Manuel. So Manuel, you gotta come down to my height.
Okay.
And this is Manuel, and he is a video editor, but he's really a lot more, and he's doing some really crazy 3D graphics. So that's probably in another 6 months you're gonna start seeing some of this stuff. So I appreciate everything you do. And then there's Jennifer somewhere. in the background. Jennifer keeps a low profile all the time. Sometimes we don't even know if Jennifer's here. Jennifer, come on, it's Christmas time. This is Jennifer. This is actually Frankie's sister. So Frankie's sister. And Frankie's sister does a ton of stuff that doesn't get any credit or recognition for anything. She has all the website, and she deals with a lot of OG recovery. She's absolutely outstanding. Thank you.
Thank you.
So it's a great team. I have a really great team, and I want to point them out because they really don't get any recognition, and it does take quite a bit of work to generate this type of content, and it just allows me to get an idea, and then I'm like, Paola, we got to make this fiber guard. And she's like, oh, not another project. So anyhow, let's just wrap it up here because it's getting on 2 hours. And I just want to, is this up, the protocol? So this is my OG protocol. It's pretty simple. It's pretty straightforward. We haven't gone through it all, and I really wasn't going to talk about this until tomorrow, but what the hell, we're going to do it today. And this is just something simple, but this is based on all of those things I talked about, my reasoning, my philosophy. I think this is, at least at our time of where we are in our knowledge, I think this is the best way to recover from a BBL. And I'm just going to go through it from top to bottom. It's just written out with time frame. So FAHA, 12 weeks after surgery. We know that's the 6 weeks, 24 hours, and 6 weeks, only 12. Then you're going to do the foams, 2 weeks. Boards, 2 weeks. The FibroGuard, you're going to see there's a space here because you're not using the FibroGuard during those first 2 weeks. That's when you're using the bone boards and the foams. That's static, that's compressing things, there's no movement. But then at the 2 weeks, we're going to be really dynamic, and we're going to get that fascia and skin nice and soft. And so that's when the FibroGuard comes in. That comes in at the 2 weeks, and you continue that basically for as long as you wear your FAHA. That's a 3 month. The roller, that's a little bit more variable, but I want you to start the roller right away at day 1 to get the nerves. Then you use it for the first 2 weeks in the more traditional manner, and then you use it as a manual lymphatic drainage tool, and for really as long as you want to, as long as you feel you need to. That's really kind of more up to you. And just your thing. Things we're going to be talking about tomorrow, the OG scar system, that you're not going to start for 3 weeks after surgery. We'll talk about that tomorrow. And then the massages, we talked about traditional massages, and then the manual lymphatic drainage massages. Both of those two happening over the first 4 weeks. This is a protocol. It's a written out. It's a PDF. You can get access to this and follow this. There's a lot of other things that we're going to be talking about tomorrow. We're going to be going through, as I mentioned, some of the other things earlier. I'll be talking about diet and exercise and giving you some information there. So I'm not going to go into that, but it's going to be a full 2 hours again tomorrow. There's going to also be time for questions tomorrow as well. Perhaps a little bit more time. I think tomorrow I put 2 spots for questions because I know it can be a little bit frustrating to watch somebody speaking and you can't be like, hey, I got a question. So if there's something that you didn't get answered tonight, tune in tomorrow at 7 o'clock here, and we're going to be doing the exact same thing. I'm going to be running through the rest of the talk and taking any other questions you have on the protocol or anything at all regarding BBL recovery. So thank you for tuning in, and I appreciate you watching, and I hope this was helpful. If you have any questions, you can always leave a comment. I'm pretty good about answering the comments. Or you can email me directly. My email is just drwilliammiami at icloud.com, and I'll answer your email. And if you have any questions about anything, you can always email me. That's pretty easy. So thank you very much. I appreciate it. I appreciate everyone for helping me. And we will see you right back here tomorrow night at 7 o'clock.